anyone say something? Because right now I can't. Guys.
Hi, can you hear me?
Yeah, I can hear you.
Yes.
So welcome to the first week of
We can't, I'm sorry, I can't hear you.
Oh, okay. What about now? Can anyone hear me? Give me a sec.
No, I still can't hear anything.
Can you hear me now? No? Oh, okay. Does anyone know how to solve this? Because I'm not sure.
Oh my gosh, I can't hear like anything on my end.
Alright, hold on one second. maybe I'll try to speak up louder, but no. Can we just type? Maybe. Sorry, I'll get it fixed for next session.
Yeah, so you can click on switch to phone audio, and I think then you can put your cell phone number, or you can test your speakerphone and microphone and see if that's working. But I would try iPhone.
Hi guys. Can you hear
It
me?
works. Yep.
Oh, okay, awesome. Thank you.
You're welcome.
Okay, anyway, so for this tutoring session, I'm not sure if you guys cover any lectures in class yet for week 1. Have you?
Yes. Well, personally, I'm in week 2.
What chapters did you guys cover for week 1?
Week 1 was 1. It was 1 for 7. 1 for. I don't know. Actually, let me tell you.
So I have right here is well, this is I'm using an old syllabus, so I'm not sure if they made.
It's 1, 2, 4, and 7.
Yeah.
For week
Okay.
1.
Awesome. Yeah. So do you guys have any questions that you guys have? I'll try my best to answer them, and if I can't find like the answer right now, I'll email like a professor and get the answer for you guys. So a little bit about me. Right now, I took TAPO about 5 terms ago, and right now I'm in OB. So my memory is like a little bit fuzzy, but I did a little bit of review, so hopefully I can help you guys, maybe a little bit. So any questions for me so far?
I'm on week 2. Is that still okay to ask?
Yeah, that's fine. Cause I have the book with me, so we can go over any concepts that you might have.
So my professor covers videos, and so she kind of does like a lecture. Right now, I'm on chapter 13, which is blood.
Mm-hmm.
So I think it is 13. All right. Let me give you the proper chapter. Is it 13? Let me see.
So I have it here that in week 2, we should be covering 10 through 15.
Yeah, 10, 13, 14, and 15, right. So, yeah, so I went over chapter 10 already.
Mm-hmm.
And then, so I guess something that was a little hard to understand was the MC1 and MC2.
MC2?
Yeah, MC1 and MC2, the ones that are binding and helping fighting the immune system.
Do you remember, this is chapter 10, right?
Yeah, chapter 10. So it's in the B cells, which are the memory cells, and T cells, which mature in the thymus.
Mm-hmm.
So I don't know, just a little bit of trouble understanding MCH1 and MCH2.
Give me 1 second. I'm still trying to locate. Do you have the page number by any chance?
I did. Hold on. Give me 1 second.
And this is about B cell and T cell?
Yeah, so MCH1 binds to the B cells, I believe. And then, so it's around page 220. I have the PDF format though, so I'm not sure if that changes.
Okay, give me 1 second.
So I believe MHC1 lets white blood cells know it has an infection, and it kind of binds to the cell, and they're called cytotoxic, which is MHC1.
So the MHC1, this does not look familiar to me. Give me 1 second. It's the compatible. So chapter 10, wait, okay, this is. So this week, you guys are supposed to have a quiz. I'm sorry, I'll get back to the questions in a little bit. So this week, you guys are supposed to be doing a quiz for chapter 1 to 7, right? Guys?
Yes.
And I was wondering if we can go a little bit over the chapters that you guys are getting quizzed on. So maybe prepare for the quiz a little bit. And in regard to the chapter 10 and the MC receptor questions, can I get back to that after I locate the section?
Yeah, I don't mind. I thought you guys were on the same. I thought we were all on the same week. So yeah, I don't mind.
Okay, Yeah, because so in week 2, the chapters that you mentioned, chapter 10, 11, 13, and 14, you guys are covering that this week, but the quiz is going to be for the week before, right? So can we go over 1 to 7?
Yes, please.
Okay. Are you guys doing the wait? Who in here has Professor Ken? Oh, who do you guys have for Patho?
I have Professor Ken.
I have Park.
Did he mention how to like oh so as far as I know, for Professor Ken, the best way to study for his quiz is to do the practice questions that is on the blackboard. Is there like I don't remember because it's not in my syllabus anymore, but is there like sections under Blackboard that contain like a set of practice quiz or something that you guys are supposed to be doing weekly?
So for Professor Ken, we have
You guys,
check your understanding assignments.
and how many questions are in each?
I believe there are 40 questions.
Okay, so when I took him, that's all I did. I obviously listened to his lectures and do those practice questions, because Professor Ken tend to like, so he tends to take questions directly, like straight up from the practice questions. So maybe that might help.
Okay, yeah. We also have a study guide.
For Professor Ken, he gave out a study guide?
Yeah, he gave us study guides as well.
Is there anything on the study guide or anything from the practice questions that you were kind of like unsure about that you want to discuss?
Not really. I kind of, I'm not sure if everyone else agrees, but maybe we can just go over from like, go through the beginning of chapter 1.
Okay. Is everybody okay with that?
Yes.
Okay. So chapter 1. Chapter 1 is, so chapter 1 is introducing, basically an introduction to what patho is and what is included in the patho. So when we talk about pathogenesis or pathophysiology, is everybody familiar with like what pathophysiology, like the central concept of patho, what it is? Or do you need like clarifications on what pathophysiology is?
Okay, you're still not eating your stuff. You don't know how to fucking share.
Hello? So does anyone have like questions? Let's see.
I do, but it's for week 2, so I'll wait.
Yeah. Maybe to competitive. Okay. So it's a brief summary. Okay, so what I have is so first we can define pathophysiology as the study of physiologic abnormalities in the human body, like what's going on when something is not working. So the goal of pathophysiology is basically to identify and even understand how the body responds to things that are not normal. So there are multiple causes. Well, for instance, in one disease, right, you have multiple causes that led to like the development of that disease. So, but for diseases or for symptoms where you don't know what is causing the disease, then the term for that is idiopathic. So idiopathic means that we don't know what's causing it. And then we have for cases where the person comes to the hospital and actually acquires something from the hospital or developing something as a result of like medical treatment, then the term for that would be iatrogenic. Any questions so far? Do you guys need like example of like idiopathic or iatrogenic? Okay. So for a disease, right, if when we have factors that would lead to the development of a particular disease, and those factors would be called risk factors. So, well, you can like interrupt me anytime, okay? Because right now I'm just going down like the list of what I remember from Patho. So just feel free to kind of like fill in more information as we go. And so for Patho, during when a disease happened, there would be signs and symptoms of those of the disease, right? Either like fatigue or headache or discharge or just anything. Any sign of the disease would be called clinical manifestations of that disease. And the clinical manifestations is divided into subjective and objective. So subjective manifestations can be seen under like labs. You can do lab work and it will show like the abnormal values, and those would be the objective information in regard to like that disease. But it could be caused by like other things, so we don't know. But so far, those information that you collect from labs would be under objective. And the subjective information is what's being felt by the patient, by the affected individuals. And those subjective information is termed symptoms. Okay, and
So when I took the quiz last week, there was also questions about what is modified and non-modified risk factors. So you should definitely know like the types of risk factors that can be changed and some that can't be changed.
Yeah. Mm-hmm. So what are something that can be changed? What are some modifiable risk factors? Guys. Yeah, and drinking in terms of like alcohol, right? And diet. Yeah. Okay, so you guys got this? And what are something that cannot be changed? Yeah, age. Mm-hmm. Yeah. Anything else you guys want to add? Like other concepts or something like that? I don't know what I'm typing. So for medical history, it has its own category. So, but then from from the patient's medical history, you can like gather objective data. That would, well, I've been to Asia recently, or I've been drinking more. Well, being to Asia recently falls under recent traveling history, and I would say it's objective because that's like something that can be proven. And but I've been drinking more. I've been drinking more is kind of subjective because what's considered as more? Because what's more? Well, okay, I'll take that back. When the patient say that I've been drinking more, we can consider that as like subjective information. Because more is kind of hard to like pinpoint what's more. You kind of need to have like a value, like a set value. Like for example, I've been drinking like a bottle more than I usually do. That would be like objective because you've like been drinking a bottle more. Do you get what I'm saying? Okay, cool. Any more questions, guys? Okay, so I would like to go over some prevention. So we have primary prevention, secondary, and tertiary. Do you understand what is like the difference between those three? So for primary interventions, these are things that you can do before you develop like any signs or symptoms, or before you've been diagnosed with a condition. So primary interventions include sanitation, like washing your hands before you get sick, and or vaccination, or even diet change. And secondary interventions is screening. So it kind of overlaps here in secondary interventions. So the disease, some say that like the disease is already diagnosed, but it's not so severe that like it's not so severe that it's heavily affecting your daily functioning. But the preventions include, I mentioned screening, right? But for tertiary, the reason why I brought that up is because for like tertiary, during tertiary interventions, the disease is already diagnosed, so you have it, right? So the only thing for tertiary is just to like rehabilitation, to kind of like try to adapt to your disease. So, guys, any questions? Should we go over chapter 2? Okay, so for chapter 2, I have right here that it is about homeostasis and how the body adapts to disease. Do you have any like particular like specific questions regarding chapter 2, or you want me to like kind of go over roughly what it's about? So homeostasis is basically the body's tendency to stabilize itself despite changes both internally or externally. Does that make sense, or do you need like an example of like homeostasis? No? Okay, so I'm just gonna go over how the difference. No problem, welcome. So if you have any questions, feel free to just interrupt me and ask, because right now we don't really have like any questions or anything that like we have to go over, or okay, anyway. So the difference between homeostasis and allostasis, does anyone know what the difference is? Yeah. That's true. So, so homeostasis. Brian is right that homeostasis is the body's normal balance, is how we try to keep things in balance, and allostasis is like allocating resources to organs that need them in a way that it would make the body function optimally. So should we go over the GAS system, the general adaptation syndrome? So the GAS system is divided into three processes. We have the alarm stage, which is the fight and flight. I remember when I was taking patho, this questions would come up a lot, so I'll try to cover it. So during the alarm stage, we have something called let's see. The sympathetic, the sympathetic adrenal medullary system. So during the sympathetic adrenal medullary system, the hypothalamus, so obviously you the organism is going to send some kind of stress, right? And then this system would activate. This system is called the sympathetic adrenal medullary system. So what starts the system is the hypothalamus. So first, the hypothalamus would release a hormone called the corticotropin releasing hormone. This, let's see. Do you need pictures? Let me see if I can find pictures. So yeah, there. Pituitary gland. Yeah, I'm trying to like project a screenshot of the system on here. So, let me see. I can't show the pictures. But anyway, so the sympathetic, the hypothalamus will release CRH, which is corticotropin releasing hormone. Then this hormone would activate the sympathetic nervous system. So the job of the sympathetic nervous systems include dilating the pupils of the eye so that more light would like go into the eye, so your field of vision would increase. And the sympathetic nervous system would also increase the heart rate. And the reason for this is that it needs more oxygen. So it can supply the body with more oxygen to kind of deal with the stressors. And there's also dilation of the lung bronchioles. Same, just basically for more oxygen. The sympathetic system, however, constricts the GI. So during fight or flight, your stomach would not be like digesting food at all because the body is trying allostasis, right? Remember the allostasis concept? So the body is trying to allocate the energy that it has towards like other systems such as like the skeletal system or the heart to help the body fight through the stressor. So the GI, the stomach would not be working. Did you? So when the sympathetic nervous system is activated, the adrenal medulla, which is the inner portions of the medulla gland. Okay, sorry. So the adrenal medulla would release norepinephrine and epinephrine, which in common terms, could you explain how sex hormones play a role to gas? Sex hormones? The adrenaline, wait, sex hormones? Which one? Oh. I'm not really, give me a second about that. Testosterone. So during this, wait, I lost my tab. So during gas, I'm not sure if testosterone and estrogen hormones play a role in that, because the only hormones that were covered was norepinephrine and epinephrine, which is the adrenaline, as well as cortisol. So in regard to testosterone and estrogen, I'm gonna have to get back to you on that. Let me make notes. But I believe that because testosterone would increase like let me see. Testosterone and estrogen in gas. Okay. Wait, Brian, where do you see those hormones in the book? In chapter 2. Can anyone send me a copy of the study guide so I kind of like have a list that I can go down or something? Wait, this is the PowerPoint, right? For the study guide is embedded in the PowerPoint, or? Oh, okay. And let me scroll. This is really long, guys. What page? Oh, okay. Who do you have for like Paso, Brian? Do you have an yes, please. Page 25. Page 25. Page 25 on the PowerPoint or the book. Oh, so for me, page 25 is the question. It's which of the following is an example of primary prevention? So that's probably not it, huh? Let me see. Okay. Let me find that real quick. Page 19. So from what I just read in page 19, it says that estrogen decrease cortisol binding in the brain. And this would in turn decrease feedback control of the gas system. So what that means, well, I'm gonna need to like get back to you guys on this just to be sure that I got it right. But what I think is that estrogen, because it's not letting the brain use the glucose, so this organism is more likely to not be able to stabilize its environment after the stress, after the is trigger. What's that process? After the alarm stage is triggered. And testosterone increase heart rate and blood pressure. So it helps with delivering oxygen to organs that need it. But then again, I'm gonna have to get back on that. Yeah. Okay, no problem. Okay, study guide. Is there anything on the study guide that you would like to go over? So right here we have are we okay with like the etiology, what it is, and what signs and symptoms are? Oh, Proto-Oncogenes, Oncogenes. Okay, so in the human genes, cancer specifically. Let me pull up the page. Okay, so the cancer genes are grouped into two classes. So we have proto-oncogenes and tumor suppressor genes. So proto-oncogenes are genes that how do I say this? So we know that these genes have the potential to become cancer genes, right? So when a proto-oncogene become ineffective or mutated to where it's not functioning and is supposed to, then it's called oncogene. So when it finally becomes like cancerous, we call it oncogene. Does that make sense? And then there's the tumor suppressor genes. So tumor suppressor genes are genes that are responsible for like regulating cell development. So it's the goal of tumor suppressor genes is to regulate when the cell is supposed to like stop dividing. So when the tumor suppressor genes is not working, the cell is no longer able to like control itself. So it just keeps mutating and dividing. Can tumor suppressor genes be shut down by oncogenes? tumor suppressor genes, can it be shut down by oncogenes? That's a good question. I guess it would depend if like the tumor suppress, if the oncogenes is affect. I would not think so. Because I was thinking that if like, wait, how do the tumor suppressor genes stop working? The tumor suppressor genes stop working is because of a mutation or because of like some damage to the DNA, like mutations or like radiations that could cause any damage to the tumor suppressor genes. One can also be born with like a malfunctioning tumor suppressor gene. Is that informative? I feel like. Okay, let's go back to the guy. I really like the PowerPoint that you guys sent. When I was taking Dr. Ken, he did not like send out PowerPoints like this. He would just talk about it. Yeah, it's really long, I know. Yeah. But what really helped me with the quiz and exams was those questions that were supposed to do weekly or something. Those were really helpful because they took questions straight from that. I'm talking about pathophysiology. What is patho? Well, you don't, the discussions? No, not the discussions. So weekly, you guys have to do like a set of questions, right, to prepare for the quiz or something, right? Like there's a list of, I think it's on Blackboard or something. But yeah, patho is really important in core. But you don't have to like know everything that you're learning right now in patho because in core, these things will be repeated. So it's not like, oh, I have to know, like, I have to remember everything. You just kind of know the basic concept of like, oh, what caused like kidney disease or like what goes on during each progression. But you don't have to like remember details about it. But it's good to know. Yeah. Right now, I'm taking maternal and newborn. So I'm like 6 terms away. Yeah, thanks. It sucks. It's hard. Well, it's not hard. It's not hard, but there's a lot that you have to know. And I feel like what's really difficult, what's been really difficult is not being able to attend clinical because like during clinical, everything that you learn in lectures will be applied. So it helps with like learning a lot. But when you can't really attend clinical, you're not really like reinforcing what you've learned, so it's kind of like fuzzy and ambiguous and kind of it's really difficult. But the course itself is not hard. It's not hard. It's just a lot of reading. Any more questions? I like questions.
Hi, I have a question.
Yeah.
So recently I took my first pathophysiology test, no, not the test, the quiz.
You took the first quiz?
Yes.
How was it?
Okay, I didn't really study, that's what I thought. But then still, like, there are some terminologies that I like haven't seen before. But then, yeah, English is my second language, so it's like, oh my God, like, what is this words, you know? And I got like the worst score in my life, I would say. And I was having actual like panic attack when I actually saw the first question. So what would you recommend? Like, how do you want me to study to do better at the next quiz?
So do you remember the questions that you were kind of like having a hard time with? Were those questions? Wait, so the problem was because there was a lack of studying, or like what?
Yeah, I can definitely tell it was because of lack of studying, but still it was pretty hard.
Yeah, it's pretty difficult.
So I don't know if I have to like read off the book more, because when I saw some people ask, how do you study for pathophysiology with the Professor Park, and they're like, oh, you don't need to read a book, everything is gonna be on lecture. But then I did listen to the lecture several times.
Yeah.
Still, there are some information that's not on the lecture, because the lecture are really easy. It's just, you know, it's like a physiology, and she explains really well. But the questions are like, they're like, oh, what would you do? But then everything, 4 of the answer look like the answer, but it's not.
Yeah. So when I first took my first quiz, right? It didn't go well either. It was really depressing. But I've learned that all the multiple choice, all the questions, all the options are going to be similar. They're gonna be right. But your goal is to pick the one that is best out of like all those options, even though, you know, they're all right, but you kind of need to prioritize. It's difficult to explain without like a question. So if you're taking Professor Ken, I'm hoping that he didn't like make any changes to his quiz. But when I was taking him, what helped me was doing the practice questions that's on Blackboard like 5 times. Do you have those questions under your Blackboard? I think, what was it? I think it's check your understanding or something.
Oh, it's like 20 questions. That one is easy compared to.
Yeah, you keep doing them. Do you recognize any question from the check your understanding? Were there any questions that he put on the quiz that were like similar to the check your understanding?
To check your understanding is actually easy, but the thing is the actual test is like different. It's kind of similar format, but still it's really kind of confusing. And like people are talking about if you go to YouTube, go to her, like she has a video on her YouTube, but then I don't know how can assist her.
Does anybody have like a favorite YouTube channel for Papa learning that they want to share?
For real, I need them.
Yeah, like I'm not sure about YouTube because I didn't go on YouTube for Patho. But let's see. Guys, how was your first quiz? And do you have any like tips or tricks on how to do better on like the following quizzes that you want to share with your classmates?
Oh my god, found it. Found it.
You found a channel?
Yeah, I'm gonna subscribe and watch it.
All right. But try to go over the terms. If like the terms look confusing to you, then it just, well, it might not be, but oh, he does, watching YouTube videos. And if it helps you guys. But it's better to go over the concepts to make sure you know it before you take the quiz. Like right now, I feel like the tutor, yeah, Paso. That's true.
Okay, thank you.
Yeah, no problem. I hope it helps a little bit.
Yeah, I will see you next week probably. Bye.
Okay, tell me how you do next week. But wait, so your next quiz is going to be week chapter 10 something, huh? 10.
13, 14, 15.
Yeah, those are pretty long, so you might want to like break them into days where you can study each at a time or something.
Okay.
And wait, so who in here has not taken their week 1 quiz? Brian, who are you taking again? Oh, I didn't take him, so I can't give you any tips there. Okay, guys. Yeah, most of the West Coast. Oh, that's nice. Yeah, nice that you can trick device. But most of the West Coast university professors, they're pretty good and they're pretty available too. So you might want to hit them up because sometimes they would like give you tips. So basically like questions that are going to be on the quiz. So make sure you you meet with them for like office hours because that would definitely help. He would, well, Ken and most of all the other professors that I had, they would give out answers and questions during office hours. So use that. Yes, oh, you guys, I forgot this. Let me see. So I'm supposed to send out this QR bar thing so you guys can check in the QR code scanner, but I'm not sure what respondus is. Respondus. Oh, is that the new Proctor? Oh. Oh. Okay, let me see. Oh, that's weird. Respondus. Do you have to pay for that? No, right? You don't have to pay for that. That's you. Okay. Yeah, you shouldn't have to pay for like a program that's gonna monitor your gene. No way, no way. But how do you? So I'm downloading it right now. I'll let you know. Okay, yeah. Um, so I downloaded mine from that, and it didn't ask me to pay or anything. Oh, never mind. I lied. It did. Okay, so hopefully you, IT can help you. Okay. That's weird though. Like you shouldn't have to pay for something that was mm, share. I'm trying to upload something. Okay. Guys, do you have something called QR code app or something? Let me see. Let me see if I can send you the link. Yeah, it is. Well, thank you. Yeah, that's a good resource. But can everyone download this QR code app so we can check in? QR code scanner. I don't know why it's not letting me share this. Okay, so I'm trying to share, but no. Give me 1 second so I can share this. Okay, I'll be right back. Let me see if I can share this. Let's see. Um, so right now I'm having a hard time showing my screen because I don't know who the host is that disabled my screen sharing. Can you guys smart? Okay, let me see. I can see it. Okay, let me see. Okay. Okay. Let me know if you guys can like scan it or something. Yay! That's so smart. I didn't think of that. No worries. So let me know if you guys still need to like scan it. So, can I take a screenshot? Oh, okay. 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 Anyway, so what should we cover next? Is there any concept that's kind of like fuzzy that you want to like cover, or should I go down the list? Oncogenes in the cell. Yeah, so the genes are located in the nucleus of the cell. Remember, DNA are like located in the nucleus. Every cell would have a nucleus. Yeah, so the genes, the whole gene, like the set genes that an individual has, would be stored in the nucleus. That include oncogenes, tumor suppressor genes, all the genes are like in that little the DNA helix. Yeah. Okay. So do we know cancer warning signs? It's like what, 7? Yeah. Where are they? Changing bowel movement, unusual bleeding, thickening a lump, indigestion. Yes. Yeah, the acronym. Well, some people experience weight loss, but other people, I guess it depends on where the cancer cell is located. If it's like located in your digestive tract, then yeah, weight loss would be the big sign. But for like cautions, acronym, I don't think that cassia is part of it, right? It's just change in bowel and bladder, right? Yeah. And usually people experience a lot of like weight loss during chemotherapy or during treatment of that cancer. Are we okay with grading and staging a tumor or cancer cell? Okay, so yeah, so grading would be what the cell look like. I guess they'll call it histology, like the study of tissue. Can you talk about talk? Let's talk about talk. What? Yeah. Okay, of course. Okay, so grading is what the cell look like if it's if the border is like not look. So grading is more on the appearance of the cancer cell, right? When the patient coming for like to see where if he has cancer or if where he is at stage 1 or stage 2, usually the physician will like get a biopsy, and with the biopsy they're able to see like the cell, the composition of the cell, and if the cell looks abnormal and if it looks so grading is what it looks like, while staging is where it is. Yeah, basically, yeah. So for more on staging, it really is about where have the tumor spread, like if it has spread and where it is from, like the origin location that it's supposed to be in. So for staging, there are multiple stages. Stage 0, So in stage 0, we know that the cells are abnormal, but then the cells has not spread. So, but then we know that this could be cancerous in the future. So basically a cancerous cell that is kind of like stick to where it is. And this stage is also called in situ. So for stage 0, the cell is cancerous, but it has not spread. And for stage 1, from stage, so a good way to remember is that from stage 1 to 3, the cancer has not spread. Like, so basically 0 to 3, it has not spread, right? It's still localized. And stage 4 is when the cancer has spread. But if you want to know, like, is there a stage 5? I don't know, that would be like death, maybe. I don't know if there's a stage 5, let me check. I don't think that there's a stage 5. The stage means the cancer. Oh, advanced. So stage 5 is advanced. Some don't. Some stages don't only go to 3 and 4. Yeah. So we have benign cancer, which is cancer that doesn't spread, right? So it would like stuck in those the 3rd stage. And then we have like malignant cancer, which spread up to like 4 or even 5. And for benign, you don't have to treat it, I guess, but then it really depends on where the tumor is. If it's on the vital organs like the heart, for example, or blood vessels that the tumor is blocking, then yeah, you need to treat it. But generally, stage 5, if you don't treat it, it wouldn't kill you. Not stage 5, sorry, benign. Any more questions? Okay. Chapter 10? Okay. Okay, thank you for attending. Yeah, we can go over chapter 10. Do you have any like specific, do you have a PowerPoint on chapter 10 maybe that you can like send it to me? Thank you guys. Okay. Bye. You're welcome. Key? Your name Key? How do you say your name? Oh, Key. Is there specific questions that, wait, who do you have for Papa? Do you have like a PowerPoint for him, or do you have like specific questions that you want to go over? Was it the PowerPoint? Let me see. This is chapter. So I have chapter 1, chapter. Oh, okay, no worries. Thank you for attending. Yeah, you're welcome. Meanwhile, let me look for chapter 10.